Welcome back. September is Ovarian Cancer Awareness Month, so we're going to spend a little time right now talking about women's health. And here's Dr. Lanalee Sam with Florida Medical Center. It's always good to have a doctor in the house. Dr. Sam, welcome aboard. How are you?
I am fantastic. It's a pleasure to be here. Thanks for having me.
It's our pleasure to have you here. Okay, so September is Ovarian Cancer Awareness Month. What do we need to know?
Ovarian cancer among the gynecologic cancers is probably one of the scariest things out there. We have screening tests for breast cancer with mammograms. We have screening tests for cervical cancer with pap smears. Unfortunately, ovarian cancer, we have no accurate screening test. The most important thing is for women to just be consistent with finding a gynecologist, with getting regular exams, so that if there's anything bizarre that's going on, your gynecologist can identify it, can advise you when and if you need to seek other testing.
So no screening test. I'm always surprised, I guess, in this day and age that there's not a cure or a test for something. Is one coming anytime soon?
I don't think we have any exact, we don't have any accurate test for it. What's out there a lot of the time is women come in and say, I want to get that blood test for ovarian cancer. There is a blood test that's called a CA-125 level. The problem with it is it's not an accurate screening test because it can be falsely elevated from other things. So the only reason or the only time we move to or advise you to get a CA-125 level is if we've established that there's something wrong going on.
Okay.
How do we establish that?
Right.
You're over the age of 55 is a risk factor for ovarian cancer. You have your routine test with your gynecologist, and on exam, perhaps I palpate that there's a mass or there's something I feel.
Okay.
You tell me that you're having bloating and pain. I tell you I think we should get an ultrasound. We get an ultrasound and we see that there is a mass. That's a very good indication for saying, yes, we need to do a CA-125 level.
Okay.
If that level is raised and you have a mass, then that's when we get concerned.
And then what do you do from there? What's the next
At that point, if I have a patient, has a mass, has symptoms, and an elevated CA-125 level, and then we start talking about surgery.
Okay, and that, I want to get to surgery in a second, but before I do that, Florida Medical Center is having a lecture September 30th about ovarian cancer, right?
Absolutely. My junior associate, Dr. Mary Lena Guerra, is doing a community lecture from 12 to 1 p.m. on September 30th. And it's all about ovarian cancer and some of the signs, symptoms, and ways to decrease your risk for ovarian cancer, which people don't know, but actually being on a birth control pill at any point in your life decreases your risk of ovarian cancer.
Okay.
Little known fact.
That is a little known fact. All right, good. Good to know. And how do people go to that? How do people attend that? What do they need to do?
They can call Florida Medical Center to get registered for that program, and they can go to the Florida Medical Center website, or again, call the main number.
Okay. Robotic gynecological surgery. You specialize in that, which sounds pretty futuristic and high-tech.
Robotic assisted gynecologic laparoscopic surgery.
You need an acronym. Is there an acronym for that?
Yeah, there's nothing.
Let's make one. Robotic assisted gynecologic with RAG. What was the rest of it?
It just goes on. Yes.
We need to work on the next interview. We're going to work on some sort of acronym.
So something really, really cool that I became involved with back in 2006 is when robotic surgery first became FDA approved for gynecology. At that point, we were doing multi-port, which is robotic surgery through several small incisions. As of this month at FMC, I'm now doing single port robotic surgery, which means that we can do an entire hysterectomy or removal of ovaries through a woman's belly button. So one incision, basically outpatient surgery that years ago would have required a huge incision, 3 days in the hospital, blood loss, and 6 weeks recovery. And now we're doing it as a single incision laparoscopic surgery.
I think the scientific word for that is cool.
I think I'm going to have to take that up to awesome.
Yeah, it is awesome. Wow. And people are back at work in a couple of weeks. And
the amazing thing is it's decreased blood loss, decreased pain, and a quick recovery, ideally within a week to 2 weeks.
Is this, how many places around the state, around the country do you find this? Is this fairly specialized here?
The robotic-assisted single incision laparoscopic
we need some
surgery.
Acronyms, seriously.
Robotic CILS.
Okay.
We call it CILS.
Okay.
So robotic-assisted CILS has just been, there's only a few places and a few surgeons that are accredited to perform that. And FMC, I'm fortunate enough to have done the first of that gynecologic surgery there.
You might say that this is harder or not as hard as scaling a mountain. You would actually be able to speak to that pretty soon because you are going to climb Mount Kilimanjaro, which is all simultaneously amazing and insane. Why are you doing this?
I'm still taking a deep breath because I just read that it's 19,000 feet to get to the top of Mount Kilimanjaro. I am doing this in February 2015 as part of the Freedom Climb.
Okay.
So the Freedom Climb is an organization, a global organization dedicated to bringing awareness to human trafficking and child sex crimes. The organization asked me to come on board as their medical director for this year's climb of Mount Kilimanjaro. We'll be spending 2 weeks in Tanzania to bring awareness for, again, human trafficking.
So you're the medical director of this expedition, which means not only are you climbing it, but you're also sort of responsible for other people's well-being too?
Yes, I'm going to be looking after them as they climb and trying to prevent any air sickness and being aware of anything that's going on at that time.
Okay, you want people to help you raise money for this and find out more information. How do they do that?
The freedomclimb.net is the organization, so the freedomclimb.net, and we are having an event in Fort Lauderdale, January 10th, 2015, as a huge gala to celebrate all of the climbers, and we'd love anybody that's interested to, again, go to freedomclimb.net and join us on the Freedom Docs.
So much going on, Dr. Sam. You're busy. Why don't you go relax for 10 minutes, because you got a lot of stuff coming up, including a mountain climb.
Thank you very much. It's been a pleasure.
Thank you.